Hello dentist, how are you today? I hope you're fine. Today we're going to talk about a very interesting topic, which is impaction of wisdom teeth. We're going to talk about three things. Indications for removal of wisdom teeth, signs and symptoms of pericoronitis, types of third molar impaction, and how to remove them. Okay, can you see here? These are impacted upper and lower wisdom teeth. Can you see that wisdom teeth is the third teeth, the molar teeth? Can you see here? It's not, it's impacted, it's embedded in the bone. Okay, can you see the level of bone is up, covering the tooth? So we have to know how to extract this tooth because it's so different from the other teeth. Its level is lower and it is embedded in the bone. Okay, let's go to the next slide. Indications for removal of wisdom teeth. So if a patient comes to the clinic and he has pericoronitis, and we're going to see how does it look like on a slide. Unrestorable caries, okay, that cannot be restored. Non-treatable pulpal or periapical pathology, cellulitis, abscess, osteomyelitis, internal or external resorption of the tooth or adjacent teeth, fracture of the tooth, disease of follicle including cyst, tumor, tooth impeding surgery or reconstructive jaw surgery, tooth involved in tumor or in a field of tumor reaction. Okay, so these are the indications for removal of wisdom teeth. If any of these cases are occur or are found in a patient, so we have to recommend to the patient to remove the wisdom teeth. This is our recommendation to the patient. Let's see how does what are the signs and symptoms of pericoronitis. The signs and symptoms of pericoronitis, so the patient comes with pain, bad taste, swelling of the pericoronal tissues and face, restricted mouth opening, which is trismus, the patient cannot open his mouth, infection by spreading resulting in regional lymphadenopathy, pyrexia and malaise. Rarely the swelling may threaten the patency of the airway and breathing. Okay, so this is really important to know the signs and symptoms of pericoronitis. So the patient comes, we have to ask some questions, and the patient will answer some of these questions, and if we can, these are the signs and symptoms of pericoronitis. So if we find any of these, so this patient has pericoronitis. Let's look at the next slide. This is partial eruption of the wisdom teeth. A patient comes to the clinic and his teeth may look like this. Okay, here this is before and this is after. So partial eruption of the wisdom teeth allows an opening for the bacteria to enter around the tooth and causes an infection. So this pericoronitis allows the bacteria to pass in and make infection and results in pain, and the infection of course will result in pain, swelling and jaw stiffness and general illness. Okay, so these are two cases here. We have two different types of teeth. This is pericoronitis. Tissue is or the gum is covering the tooth. Can you see here? Here it's covering almost half of the molar. Okay, this is after removal of this this is after removal. Okay, we make incision here. We make incision with a lancet. Okay, and then it will appear like this. Okay, it's really easy to do it in the clinic. Here we have before we start to do any management, okay, we have if a patient comes, we're going to check the signs and symptoms of the patient for pericoronitis, and if we're making to ensure that this is pericoronitis, what do? We tell the patient to make a radiograph. Maybe he could do a periapical radiograph or a panorama. So this is how does the periapical radiograph look like. So a periapical radiograph is required for impacted lower wisdom. So if we have this tooth is impacted and we want to remove this tooth, so before removal it's better for us to make a periapical radiograph to check exactly where is the position and the shape of the roots, if they are curved or they are straight, and even the molar itself, if it's vertical or horizontal or mesoangular wisdom teeth or distoangular wisdom teeth. It's really important to do the radiograph to know the position of the lower wisdom. Here we can also, if he has more than one tooth, we can tell him to make a panorama. Okay, so can you see here? This is mesoangular, or it's almost horizontal. It's almost horizontal tooth, wisdom tooth. Okay, here we each type of wisdom teeth has its line of treatment, okay, or management. Okay, we're going to see how each one is going to be extracted. So here we have this vertical, also we have this horizontal wisdom teeth, and here we have mesoangular wisdom teeth. Okay, so panorama is very important for lower and upper wisdom teeth before extraction. Here we have mesoangular impaction for lower molar. These are the three types. We have three types. I'm going to talk about each type now, and what are we going to do and how are we going to remove each tooth. Let's look at the first one. Here we have vertical impaction of can you see here how does the tooth look like, the root look, the molar or the wisdom looks like? It's vertical. Can you see the position of the molar is vertical? The roots are curved, so this is another problem. So we have two problems here. It's although it's vertical, but it's submerged, okay, and the roots are curved. So let's see how are we going to remove this molar. Vertical impaction with an unfavorable root morphology requiring bone removal and vertical sectioning. Can you see what are we going to do? We're going to require bone removal. We're going to remove bone. Can you see here? This is we're going to remove this bone, okay, and make sectioning of the vertical sectioning, okay, of the root or the tooth. Can you see? And then it's very easy to remove with the elevator. Can you see? It's really easy after you section it with the burrs, okay, with burrs. The second type here we have mesoangular impaction. Mesoangular, this is mesoangular. Can you see? It's on the mesial side, so we call it mesoangular impaction. In this case, mesoangular impaction, we require bone removal and a mesial application point to elevate and upright to remove. Okay, so this is how we're going to do it. We're going to point to elevate, okay, and upright to remove. We're going to use also an elevator in this case. In case of horizontal impaction, requiring bone removal and sectioning of the crown to permit removal of the crown and then the roots in stages. So in case of horizontal, we can see here what we do require bone removal. We remove the bone. Can you see here? This is how we remove the bone, okay, and sectioning of the crown. Here we section of the crown. Can you see the removal of the crown and then the roots in stages? So we can remove the crown and then the roots in two different stages. Okay, the last one is the distoangular impaction, requiring significant bone removal to permit the elevation distally, okay, for removal without impaction. So here in distoangular impaction, we require significant bone removal to permit elevation distally for removal without reimpaction, without reimpaction. Okay, so this is how we remove the distoangular impaction. This is how to remove the distoangular impaction. So today we talked about the indications for removal of wisdom teeth, signs and symptoms of pericoronitis, and types of third molar impactions. Okay, I hope that today's lesson or session was really of benefit to you, and I'm sure it's going to help a lot of dentists, especially in the clinic, because it really comes a lot to it's a common case that comes a lot in our clinic. And I hope to you all the